Okay, now the most important thing for preparation for exam, of course, it's not possible to help you to prepare in 1 month, but I'm presuming that during COVID days, you would have opportunity to revise the standard textbooks. So this orientation is a thing for the PG, so join fresh, but I thought it should be useful for you also. There are some books which are definitely worth reading and revising. Of course, all of you know that Nelson textbook is the Bible, but now we have a lot of Indian textbooks, and there's a textbook for postgraduate teaching by Dr. Piyush Gupta. I think that is fairly very comprehensive, and you should be able to get a lot of Indian perspective in that book. Other than that, you have IAP textbook of pediatrics and Cloharty, and very important for you by now, you should be at least familiar with some journals like Indian Academy of Pediatrics or Indian Journal of Practical Pediatrics, Illingworth. Sorry for the spelling mistakes, Illingworth Development. And so this is the list of books you should have been very familiar. Now, in the last leg of your preparation, how do we go about? Right? And for those who are taking DNB exam, it is more of a fear or phobia because somebody in the past exam say, oh, it's very difficult, they won't pass the exam. 50% is yes, is due to the toughness of the question. But I think 50%, if you understand how to write, you should not have any problem in passing. Right? So with what I'm going to tell you, if you follow, probably you'll be able to answer fairly well. Now, what you should do in the next 1 to 1.5 months is to collect all the, I'm sure you have been doing that, all the question papers for the past 5 or 10 years. DNB has got it on its website. MC, I'm sure MD also, there will be some people who have collated all this. So what you should do is, I'm presuming that you have done one full reading from wrapper to wrapper in Nelson or any standard book. So if you have finished that, you got a fair idea of all the chapters. So once you get the questions, in the next 1 month, you start classifying or dividing this question based on the common chapter. Some of the chapters I don't want you to read where question may come or may not, like you have to depend on like is, like for example, inborn and rough metabolism, you may not want to read because too elaborate. Or for example, the gynecological problems or ophthalmic problems, they may at best come for a short note for 3 or 4 marks. So you can just take a guess and then write. But some of the psychiatric problems, for example, you don't have to go through every line of what is there in Nelson textbook. You have to pay a bit of luck on that and hope that those don't come. But the major systems like developmental pediatrics, the infectious disease, the cardiovascular, respiratory, CNS, you should have done a thorough reading. So have these questions sorted out by chapter. And very importantly, in the examination, a lot of times they ask for physiology. And if you look at Nelson or even Piyush Gupta, every chapter, the first 2-3 pages will devote to anatomy and the physiology. I think those who have got a good sound knowledge of the anatomy and physiology will be able to answer a theory paper very well. And also it will help you in the clinical examination. The whole reading now, at least the last stage, should be focused on how to answer a given question, right? And in this, when you are revising, memorize some of the important tables. Nelson has got very complicated tables, big tables. It may not be possible for to memorize. At least go through Piyush Gupta, where tables are smaller. For example, they'll give a list of differential diagnosis. Symptom-wise, they classify. So there are so many easy tables to remember. And when you write, I'll tell you how to write the paper. And if you are able to at least make a reproduction of these tables, it will help you a lot. Also in the textbooks, you look for some algorithms. If there are flow diagrams, simple flow diagram, you may not be able to reproduce it exactly like what in the book, at least the concept if you are able to convey. The most difficult part, what I find my students difficult to answer is when there's a question on how approach to a particular problem. We will take an example and then tell you how to do it. In your day-to-day academic activity during the 3 years for MD, lot of seminars and discussion would have gone, and maybe you would have jotted down some extra points what the teacher would have told you. So those will come in handy when you want to go through the last minute preparation. Now, when some of you asked what are the patterns, the pattern of or the papers division in MD and DNB differ. The curriculum says, okay, paper 1 neonatology, paper 2 general pediatrics, paper 3 super specialty, and paper 4 social pediatrics. That keeps changing. But what I want you to understand is there is no rigid compartment. The examiners will always, try to jumble up things and they don't stick to curriculum. So bottom line is, you can't say tomorrow is neonatology and go only with the neonatal preparation. You may get a question on inborn metabolism or something like that. So it is for you to focus on that, but there's nothing like this is out of syllabus. It was not there in the paper. That is one. Second thing, what I have seen the trend is very often there are a lot of repetitions, same questions asked in different formats. So you have to understand the questions properly and write the answer. Now, if you go through all the papers or question papers in the past years, this pattern is questioning is always there. Definition, etiology, clinical man. This is for MD. Generally, DNB has changed the format to long 10 marks question to only 5 marks question. So it's easy to score marks. For 100 marks. There'll be 10 questions which are 20 questions which are 5 marks each. So it's easy to score in DNB. But I think in DMD, they still have 10 marks question. Fortunately, there are no 25 marks question. In my days, we used to have 25 mark question, which is very difficult to answer. But generally, in each question, there will be definition, etiology. There are some issues related to development pediatrics, social pediatrics. In DNB, they tend to ask statistics. I don't know, MD, they will ask or not. Genetics or IM question may be there. There may be a case scenario, and definitely there will be a question on emergency poisoning. Some questions may be on immunization, drugs, and it. This is what I just recollect on what headings they can come. So this is for you to make sure, go through your previous papers and see how they come. Now, when writing a theory paper, that's the most important, and all students get confused. Like somebody said from King's College, we have formatted test and then we think we have written the writing, we don't get the marks. Now, currently, at least in DNB, if there's a 5-mark question, if I'm an exam question setter, I am given instructions that the student should get a clear idea of the breakup of the question. For example, define, list, they're all given 1 mark, right? Or enumerate, or just describe or discuss. They'll be given. So if it's a 5-mark question, I will divide into 3 plus 2 plus 2. So that question stem, when you see, you will know where it's only 1 mark, you will know where it's only 2 marks and where it is 3 marks. So what message I want to convey is that a lot of times there are some questions where you know a lot of things, but the question that is asked is only list. So when they say list, enumerate, it should be just list and not long text. That will help you 2 things. One, it will help you to save time, and it will also help you to gain extra marks. So list the causes of anemia in children, or list 5 causes of hemoptysis. So you just list the 5. It doesn't matter if the common or rare, but just list. Once you list, immediately the examiner will be forced to give the marks. If the question contains define, just define 1 line or 2 lines of definition. For example, if they say, how do you define asthma? If you look at the books, you could say it's a chronic inflammation of the small airways with bronchial hyperresponses, and all that is there. So you should be able to reproduce at least most of the definitions what is there in the textbook. Now, as an examiner, when I'm evaluating a theory paper, what you should understand is most of the examiners are above 50 years or maybe 40 years. And every time I am called to do an examination of evaluation of theory paper, it's an incentive based. The more papers I correct, the more money I get. at least in MD. So there is always a time frame in which I have to correct the papers. And as an examiner on the 50 plus side, my patience is very, very less. If you write 4-page answer for a question which has got only 5 marks, I don't have the time to read all the things that you have written. And sometimes it will be written in such horrible handwriting. You just read the first line, you get fed up, and then you say, okay, I'll give this very out of 5, I'll give you only 1. So how to avoid this examiner fatigue? There is some way you should capture the attention of the examiner and say that I'm going to discuss this in the following headings. Like, for example, if you take a novel, fiction novel, if you want to buy it, what you do, you look at the back cover and see this summary of whatever is that novel is going to contain. Or if you look at a textbook, what you do is either you read the preface written by the author, say what are the things that are very important in this, or there's an index or table. Similarly, when you write a theory examination, supposing there's a question on discuss the management of status asthmaticus. So your first opening sentence should be, this question will be discussed under the following headings, 1, 2, 3, 4. One is 2 lines on pathophysiology, 1 or 2 lines on what are the clinical manifestation, 1 line on what are the drugs and their dosages, and administration for what duration. So if you write these 5 points upfront when I see the question, then I know that you have got a clear-cut idea how you're going to answer, and then you go on to elaborate each one. So I don't have to go through every single line. If my introduction 4 points are bulleted points are very proper and appropriate. If I find anything that is interesting and I want to check whether you know the dosage and duration, then I'll go to only that specific point and say, okay, he has answered this rightly or wrongly, and it will help me to correct. So very important is to catch the attention of the examiner, who is a senior citizen, hard of hearing, difficult to see, and he will be kept in a closed compartment, closed room, because of all the whatever safety for malpractice. And then he'll be under CCTV camera, and he has got a time. He has to finish from morning 9 o'clock to evening 5 o'clock. And DNB exam is even worse because they have done away with peripheral exam. All the examiners will have to travel all the way to Delhi, sit in a closed room. They'll give you coffee, but you can't go out for 8 hours. So the mindset of the examiner is very, very claustrophobic. He'll be very disturbed, and he doesn't have any patience to go through it line by line. And worst is when the handwriting is bad, he'll get put off and he will straight away say, I'm not going to give you full marks. So good handwriting, bulleted text in the first paragraph, and then go to explain. Very often you will get away getting pass marks just by the examiner seeing the bulleted text. Second thing is, when possible, write simple diagrams. No need to write exactly what is there in the books. For example, there is something related to physiology. Write simple flow diagrams. If you're able to reproduce what is there in the textbook, very well. For example, discuss the management of dengue shock syndrome is the question. Then you have all the WHO flow diagram. You all done it in your day-to-day practice. You can easily reproduce it. Or supposing there's a child with inborn metabolism, how do you approach the diagnosis? So you have got an algorithm. First do ABG, then do blood glucose. You got normoglycemia, and then ABG is normal, then urea cycle defects, hypoglycemia. So you have to give a structure that you know something, and we are not asking you to do a Xerox of what is in the book, because physically impossible to memorize everything. You get the concept and you can devise your own flow diagram, no problem. But let the examiners catch this point. So examiner will easily say, I did, yes, this person's knowledge about this particular question is good. Maybe there are some mistakes here and there, one up and down. It doesn't matter. I will give him marks for this. So flow diagrams, and if possible, tables. And when possible, you can write a statement. This question I'm going to answer under the following headings, or I want to classify the answer. For example, discuss the management of a child with noisy breathing if they ask. Then you can say, I'm going to discuss this under 4 headings: upper airway, large airway, small airway, parenchymal disease. Then you elaborate it. Upper airway, I may get nasal ragates, I may get a snoring because of adenoid enlargement, I may get swallowing difficulty because of retropharyngeal abscess, voice change may be there, stridor may be there. So like that you go on. So, but upfront I'm telling, I'm going to answer this question on approach to child with noisy breathing under the 4 headings. So I know that this fellow is very systematic and organized. And I'm going to look for some keywords. Has he written stridor? Has he written wheeze? Has he written grunting? So I'm going to look for keywords. So when I'm writing like this, again, your importance as students is to catch the examiner's eye. So highlighting the points that you want to emphasize will be very good. So tables, flow diagrams, either conceived by you or reproduced by the text, writing the answer under different headings, classifying your answer, and highlighting important points, what you want the examiner to understand. Clever students tend to quote some recent articles. If you can remember, for example, if there's something recent on asthma, you can, if you read it recently, you just say from Lancet January issue 2021. Then I know that you have got some idea of the recent advances. So these are some of the tips that I can give you. And very importantly, your answer should be appropriate to the marks allotted. You can't write 1-page answer for a question, for a part of the question which has got only 1 mark. Or you can't write 2.5 pages if the marks is only 3 marks. So, and in that 3 marks question, you should be able to convey to the examiner that I know a lot of things, but because of the marks constraint and this thing, I'm going to highlight certain things. So emphasize what you want to stress, convey to the examiner that you have understood the question perfectly and you're trying to answer. Okay. Any doubts till now before I go on to give you some examples? Anybody can want to ask any doubts? Hello.
Sir, so far no chats as of now.
Okay. If anybody wants, you can stop in between. I have no problem.
How important are doses is the question, sir.
If there's a question related to management, right? For example, if there's a question related to management of status epilepticus, right? The question may be define status epilepticus and discuss the management. Define will carry 1 mark and management will carry 4 marks. When I say 4 marks, you know there's an algorithm that first you give lorazepam, 15 minutes later you give phosphonatoin, then you give phenytoin, then you intubate, then so that flow diagram. So put that flow diagram and then you go on to elaborate lorazepam dose, route of administration, and look out for possible side effects. How long you have to wait before you give the next drug, and any precaution when you give drugs like phenobarbital or phenytoin. It should be given slowly, diluted in saline, drip ratio. So if there's a question related to management, we expect you to write the drug dose and duration. For example, if they ask you treatment of enteric fever or treatment of COVID, for example, you should be able to tell IVIG or MIC in COVID. IVIG dose, steroid dose, how long you want to do, what are the side effects you want to observe. Even the question doesn't ask, if you write this, then I know actually you have handled a case of COVID MIC in your ward. So what we're trying to look at is, have you understood the subject and are you able to convey to the examiner that I have got a fair knowledge of the question. Somebody has asked difference between management and treatment. This is a fundamental question. When you say management, it includes investigation and medication. When it's only treatment, it is just medicines. That's what is the difference. If you got a, yes, if you have a question on congenital heart disease, it is necessary at least in 3-4 lines to diagrammatically put supposing there's a question on VSD, put a diagram on the hemodynamics, use different color pencils so that the arterial side, venous side, you can this thing, and few lines for description. Start from one place, the blood flows from the left ventricle across the VSD into right ventricle, across the pulmonary valve, and what are the chambers, the enlargement that you can get, and so on and so forth. Four lines you should be able to describe. What you should remember is you are not taking exam of DM level. We are looking at basics. So fundamentally, you should stick to basics, not advanced cardiology discussion. So that's what you should remember. Don't get put off by the words, complicated words or they give. Right? I hope. Yes. Okay. Now next is what are the favorite patterns that you get in the exam? Right? What you should remember is, of course, these last few years, DNB has been a little tricky. They have stopped repeating the questions, but no examiner worth his name can invent new questions, right? So your focus should be on going to the previous year's papers and see questions which are most often repeated. In any examination, there are going to be googly questions. But be prepared to answer questions on something that has been happening recently. For example, about 5-6 years back, a lot of questions came on dengue. Then some questions started coming on chikungunya. And if you're taking exam in 2022, be sure that you will get some question on MISC, COVID, pediatric COVID, whatever, or the vaccines in COVID. So be sure to be updated with the recent happenings in your hospital, maybe for the past 1 to 1.5 years, and be thorough with this answer. It's a sure shot. Because it is current, you will be able to answer it better rather than if I ask you a question on Kawasaki. There may be a question on how do you differentiate Kawasaki from MIC. So like that, it can go on. So be very sure to go through the previous year's papers, see things which are coming very often, and in this next 1 month, focus on those topics which you are not able to write offhand. For example, the question on genetics, I find it very difficult. So I will revise that chapter thoroughly. If there's a question on inborn metabolism, right? Like for example, if they ask you a question on maple syrup disease or PKU, I don't know anything about it. So your previous question papers will tell you what are the various IEMs that are asked. So as a rule, they may not ask you some very rare inborn metabolism. They'll ask you common galactosemia or fructosemia. So they may ask you something else. So circle of those questions which is difficult to memorize and remember, and at least devote 1 day in a week or 2 days in a week to read those chapters. And when you read, jot down certain points which will be helpful for you to remember or go through in the before the examination. Okay, what most often students do mistake is that they are in a hurry to write the answer, and when they're in a hurry, they don't read the question properly. And always remember, now even in MD, at the end of the question, they'll put in bracket the marks. It will be 2 + 1 + 2 + 2 something. So that will match the breakdown of the question that you give. So read the question thoroughly, read it 2-3 times, and then look at the marks that is allotted for that part of the question. Mentally prepare your answer and write. Blindly, you see this and start writing, like my friend from King's George said, there'll be no end to writing. Suddenly you'll remember something, keep on writing. Some of them may be relevant, some of them may not be relevant. So you'll be wasting a lot of time, right? So that read each aspect of the question and marks allotted each component of the questions. So you should be able to understand these terms: enumerate, enlist, discuss, write briefly, evaluate, approach to, and management. So the investigation and treatment. So that's what we have been talking. So let us go through some examples. Okay. The question here, this is a hypothetical question. It's not come in the past, or it might have come, I don't know. Enumerate the life-threatening tachyarrhythmias in childhood. And I have got 2 marks for this, right? Can anybody may take a chance and then try to answer this question? For 2 marks, what will you write? Anybody? You have to be vocal. I don't have patience to read the chat box. Hello.
I think yaru answer madilla, sir.
If you're going to sleep, then I'll go home. Shall I go home? Anybody, don't feel shy. This is only a way of understanding how exactly you understand a question. We'll call out Nisha. Who is Nisha? Hello, whose name is visible? I'll ask.
Dr. Devina Singh wants to be unmuted.
Yeah, please. Unmute and then answer. Hello. Can somebody unmute?
Hello, sir. The life-threatening.
Okay. What do you understand by this question? Enumerate the life-threatening tachyarrhythmia.
In enumeration, we just have to write the life-threatening tachyarrhythmias. Like we can enlist them. Ventricular tachycardia, ventricular fibrillation.
Ventricular fibrillation.
हाँ कि तुम्हारा ज्यादा तुमने एक्साइटमेंट में लिख दिया है 5 मार्क के क्वेश्चन में, वो चेक ही नहीं करेगा, रीड ही नहीं करेगा पहले, तो बोला मैक्सिमम कॉन्सेंट्रेट ऑन टेबल्स एंड फ्लो चार्ट लिखा है बट.
Hello. Hello.
Yes, sir.
Hello.
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 In tachyarrhythmias, we can write the name like ventricular tachycardia, ventricular fibrillation, like that.
Am I muted by chance?
No, sir. Could only one of please answer? Like many of you are trying to answer, so it's becoming unclear. Can only one of you please volunteer and answer?
With the low literacy in the mother, they all are a risk factor for.
Okay. The host, can you mute everybody? I think I made a mistake by asking. Okay. Now you are.
Sir, ನೀವು unmute ಮಾಡ್ಕೋಬೇಕು, sir.
Okay. So this question says enumerate, and I got 2 marks. That means I am expected to write at least 4. If you write more, no problem. If you write list 4 life-threatening arrhythmias, half marks for each. I'm definitely going to give you 2 marks, right? If you write more, you will not get anything more than 2 marks. You understood, no? Right? So you are ventricular tachycardia, ventricular fibrillation. Then you got pulseless electromechanical dissociation. So like that, you just write 4. If you can remember more, like any bradyarrhythmia, junctional rhythms, you write. But it should not be less than 4 because the marks allotted here is 2 marks. Then second is, how do you diagnose them? When I write as part of this question, I am asking you to write whatever you have listed, each one of them, you write how you're going to diagnose. That is one way. And because the marks is 4 here, for each one of them, if you write, I will do an ECG, I will do electrophysiologic study, or I will do a Holter monitor. For example, if there is a diagnosis is ventricular premature beats or whatever complicated arrhythmias which come in bursts like SVT, then I may be asking you to do a Holter monitor. So based on what arrhythmias you have listed, I am asking you for each one of them, how do you diagnose them? That is one way. Or in general, you can write what are the various ways you can diagnose a rhythm disturbance. So you can start with an ECG, Holter monitoring, electrophysiologic studies, and so on and so forth. But this is a loaded question. There are 4 marks for this. So your answer has to be good, maybe 1 page. But just because it's 4 marks, don't write 2.5 pages. You must write bulleted points. That's more than enough, right? And the last question is briefly outline their emergency intervention. That means the conditions that you have listed, their emergency management. So think twice before making the list, because if you've written something which is very complex, junction rhythm and all, you don't know the treatment. So write the common ones for which you are very comfortable with writing the treatment. So this is how dissecting the question. So this total marks is 4 plus 4, 8 plus 2, 10 marks question, right? DNB students will not get a question like this. Mostly MDs get 10 marks question. So by writing this, you are assured of at least 5 marks, because they'll get you some marks for the diagnosis, and definitely for full list, you should get 2 marks. So you get 2 plus 2, 4, and 1 mark somewhere here and there. Emergency management, if you're able to write correctly, maybe another 2 marks. Remember, all MD or DNB students, examiner is most unhappy to give you 10 out of 10. Forget it. As an examiner, I'll be very disappointed if I'm forced to give 7 or 8 marks. So your target is to at least get 5 marks, right? So that is what you should remember, and then write the answer accordingly. Right? Give me 2 minutes. I'll connect my power source. Okay, any questions till now? Okay, I'll just show you how this question is answered. So when I say enumerate, I'm just going to list. I've written 5 here. 4 is more than enough. Atrial flutter, atrial fibrillation, supraventricular tachycardia, ventricular tachycardia, ventricular fibrillation. How will you diagnose? In this particular key, we are just an overview of all arrhythmia diagnosis. See, important point to diagnose to be mentioned the following headings. So if you have time, because it is 4 marks question, in the ECG, what do you expect in the ECG? In chest X-ray, maybe you will get a complex cardiac disease, cardiomegaly. What do you expect to get in 2D echo? What are the conditions, indication for Holter monitoring? And of course, treadmill, we don't do it in pediatrics, so leave it up. So electrophysiology. So these are the headings under which you will write at least 2 to 3 lines for each of them, so that you can get 4 marks. Now, management of arrhythmias, you have a nice flow diagram. Instead of writing a full page of description for each one of them, if I write this flow diagram is all in PALS course they give. So examiner knows he doesn't have to go through each detail, but I know I'm looking for adenosine dose. And then here I would like you to mention the 2 syringe technique fast I'm going to give, and then some drugs and their dosages. So this is an example how you can score 4 marks easily by putting a flow diagram, right? Now, second type of question is to describe the advantages and methods of giving Kangaroo mother care, right? Enlist the metabolic consequences of hypothermia. This is in 2 parts. The 2 parts are not related, right? And this question came some time back. So here, the question is, I put it in highlight, describe, right? And I have got it in 2 parts, advantages and methods of giving. So I've given 4 marks here. So 2 marks will be for advantages, another 2 marks for method of giving. So easily you can score, you can be assured I'll get definitely 3 marks. The second part is enlist. I don't have to write long theory answers, because the question, the mark is only 2 marks here. So metabolic concept of hypothermia, because it's only 2 marks, if I enlist 4 metabolic consequences of hypothermia, I'll easily get 2 marks. So that is how I read the question, divide into components, look at the marks that have been allotted, and an answer as per marks that is allotted, right? Now, this is how the answer is going to be, right? Here, to catch the examiner's attention, benefits of Kangaroo mother care, I divide into benefits to baby, benefits to parents, benefits to community, and I go on to elaborate a little bit. And methods of giving, there are different methods: mother, father, position, comfort, baby between mother's bed, abdomen pressing, and baby head turned towards the side, support the baby from bottom, frog-leg position. So I have broken down my answers. If you have time, you can elaborate 1 or 2 lines on each of these, right? Then I told you metabolic consequence of hypothermia. I have listed 5, 8, but you don't have to reproduce. If you remember everything, you do it. Because the marks allotted is only 2 marks. If I write 4 of them, definitely I'll get full marks, full 2 marks for this. So in this question, it's very easy to score 6 or 7 marks because 2 straight away for the end list, and the methods of giving straight away I'll get 2 marks, 4 marks. And if I describe and then I describe classifying like this, I'll definitely get 2 marks. So easily I get 6 marks in this. So point I'm emphasizing, even if the question says describe, it's better you describe it under different headings so that your answer gets broken down and the examiner also finds it easy to allot the marks for you. Okay. Next question is, in the long back it has been asked. Classify severity of dengue hemorrhagic fever. Very straightforward. You have read the WHO guidelines, you just classify it. 3 states are there with warning signs, without warning signs, and describe straight away, you will get easily 3 marks. Write in brief the management of dengue shock syndrome. You just reproduce the WHO algorithm for dengue shock. 7 ml per kg, 5 ml per kg, bolus push, all that you write. And you'll get easily marks, right? I just copied it from the book, but this is how it should be. This is the old classification, but it should be up to date with new classification. So management, like I said, it's a partly investigation and partly treatment. So what all investigations you want to do? Hemogram, liver function test, and then the platelet count will include in this thing. And specific investigations you'll write to confirm. Treatment, mainly supportive fluid management. You have to elaborate a bit on this. So that is how you talk about discuss management, right? Now, the most important or most difficult, I'll say, is discuss the approach to the diagnosis of a child present with polyuria polypsa. This is what you do in your clinical medicine, and you should be able to think of all the conditions, what can cause polydipsia, and then write the answer under the following headings. 1 is history, 2nd is examination, 3rd is laboratory. So the approach to a child with polydipsia in history, I'll ask for example, what are the cause of polyuria polydipsia? It may be diabetes insipidus, it may be renal tubular acidosis, it may be diabetes mellitus, it may be psychogenic. So what questions I'll ask for diabetes insipidus? For example, histiocytosis can produce headache, rise ICT, seborrheic dermatitis, or ear discharge, chronic otitis media. Will think that it is diabetes insipidus. Renal tubular acidosis, failure to thrive, metabolic acidosis, rickets-like changes, motor delay, failure to thrive, Fanconi syndrome will be there. So that is for renal tubular acidosis. Then diabetes mellitus, failure to thrive, DKA-like manifestation, and thirst, family history of diabetes. So these are the headings under which I'll answer the question at history. Physical examination, I'm going to look at the head-to-toe examination. I'll do a thorough CNS examination, and then I'll look for signs of dehydration. I'll see if there's a bladder palpable. Then I'll see for all the seborrheic dermatitis and eczema and things like that. Or I'll see if there's any behavioral psychological problem, adolescent. So like that at history level. Then investigation, you say, I would like to look at the urine specific gravity. I want to measure the urine volume over 24 hours. Then I want to do water deprivation test. How do I interpret water deprivation? So that way I'm able to answer. And this is a broad question. This is an MD question, and there's no breakup of marks. That means you have to imagine that they're going to give different marks for different components. So out of 10, 3 marks maybe for history, another 3 marks for maybe for the examination, another 4 marks for the laboratory. So like that you divide. If you want to make it simplified, and if you're able to remember an algorithm, this is difficult to reproduce, but if you remember, you can do like that. That way you'll save time trying to write elaborate essay type of questions. So history you ask, then physical examination and CNS examination is what to look at. So this is how you approach. The question that can come for approach is, write the approach for a child with a progressive pallor, or write the approach to a child with transfusion dependent anemias, write the approach to a child with failure to thrive, write the approach to a child with refractory congestive cardiac failure. So these are all different questions on approaches, and you should be able to answer these under these headings, that is history, physical examination and laboratory, and if possible, try and write a flow diagram, right? Now, the most difficult thing what I find the students is questions related to social pediatrics. This is a googly, and even the best teacher cannot help you. The only way I can tell you guidelines, help you to remember is, one, you be aware of all the national programs currently. For example, when I was a PG, that time universal immunization program and expanded program of immunization was in vogue. That's when Indira Gandhi introduced. But now you got so many things on vaccine, right? So you have to look at what is the current. Like, for example, Mission Indradhanush, they say, where they have targeted population. Or you have got IMNCI program. And for some time, it is an ICDS program. It got changed to RCS program, and it got to IMNCI. So be familiar with the currently administered national level programs and state level programs. There are different programs for example, in Karnataka, they have Tottelu Bhagya and things like that. They're locally available programs are there for mother and child. So be familiar with them. They will ask you what are the objectives, what is the target population, and what is the goals for this particular program. So that is one way of addressing social pediatrics. You must know the currently running national and state level social projects that directed towards mother and child. Second thing is, lot of times in common Indian journals or in Western journals, there are editorials. Lot of times editorials will discuss the social issues. For example, if you take New England Journal of Medicine, there's one chapter dedicated to social pediatrics. What is currently in vogue? Like, for example, economic outcome of COVID pandemic, right? Very well discussed in New England Journal of Medicine. So you must be familiar with some common journals like British Medical Journal, New England Journal of Medicine, and for Indians, Indian pediatrics. And if you look at the past 1 or 2 years editorials, lot of times they'll be addressing burning social pediatric issues in these journals, and some of the studies that are related to social pediatrics. So your job is to be familiarized with that. That is number one. Second thing is, at least personally, I feel social pediatrics is one where everybody can be wrong and everybody can be right. More so, the examiner can be wrong and students can be right. So I will use a very crude word that this is one paper where there's a scope for bluffing. It's a crude word. Don't quote me. Don't say that Dr. Subba Rao asked us to bluff. Because what happens when I'm evaluating a paper, I may not be very well aware of what is current. So I'm looking for certain headings and how much you have written. It may be a 10 marks question. And I may say, okay, I'm getting fed up. I'll at least, for having written something, I'll give you 5 marks. One very important message I want to tell all the students: do not leave any questions blank. Because if you don't answer a question, even on social pediatrics, it means I can't give you marks. I'll be forced to give you 0. If you write something, at least I'll give you 2 marks, and 2 or 3 marks can make a lot of difference in between pass and fail. I've had students who got 49 marks out of 100, and for 1 mark they have failed. So don't, if the question is difficult, Write something, whatever comes to your mind. Our examiner will have sympathy. For having written something, I will give him a consolation marks. But if you know something, write thoroughly. You'll get full marks. But at any cost, don't leave a question unanswered. That means you're straight away getting 0 and then you'll not get anything. Write something, whatever you know. Don't write stupid things like Om Namah Shivaya or Venkatramana Swami or something. I've seen students write, God, please save me. This is my 3rd attempt. They would have written that. Don't write that. Do write something which is relevant and scientific so that examiner will feel sympathy and give you few marks. Right? So that is my take on social pediatrics. Go through the editorials of some of the Indian books. They'll have quoted. Maybe sometimes editorials of newspapers also will address some burning issues in pediatrics. So that is what you should be thorough. Usually social pediatrics is in the 4th paper. So if you've done first 3 papers very well, you can get away with writing something in the 4th paper. And it's very, very difficult to predict what questions will come because the previous year's question paper will contain only social pediatric issues relevant to that time and may not be. If you look at 10 years paper, nothing may be there on COVID or corona infection. But if you look at the current one, they'll talk about the how you set up a COVID care center, how you respond to pandemic. If you are a district administrator, how will you manage your resources? For example, you heard there is an oxygen scarcity. So how will you manage resources? So like that, you can ask any type of question. So look at the recent advances, recent articles, either in journals or in newspapers, and then write down few points. It will be easy for you to help. So finally, answer all questions. Very important. Don't leave any questions unanswered. Divide your time. For example, if you've got 5 marks question in DNB, I'll have 20 questions and I've got 3 hours to answer this 20 questions. So 3 hours divided by 20 questions, you'll roughly know how many minutes you can allot for each question. And if I got 10 minutes allotted, I should be able to write within the next 8 minutes the question and then go to the next question. For example, if you felt that you don't know the answer for a particular question, you can keep it to the last so that if you have time and you get some flash answers, you can write. But I'm told that in DNB, you have to write the answer in the same sequence as the questions are given. But I don't think that is required in MD. You write the question number clearly. You don't have to reproduce the whole question. You write the question number and then go on to answer. You can ask the last question. You can answer first and first question you answer number 3. It doesn't matter. But you should write the question number very, very clearly so that I can understand what you're reading. Very, very important. Unfortunately, nobody can change it. Your handwriting. The most worst thing that can happen is you written everything, but your handwriting is so horrible that the examiner gets fed up and he'll say, just say, I'll give you only 1 mark for having horribly written. So those who got horrible handwriting, please depend on flow diagrams and pictures to get your marks. Those who got good handwriting will gain, but their problem is with good handwriting, your mistakes get stand out. Examiner will read very, very carefully good handwriting. So it is plus and minus, but try and improve your handwriting. Writing in bulleted text also is not a problem. You don't have to write paragraph after paragraph because I know that in DNB, they do not give any additional seat. In my time, I could make any number of additional seats. In DNB, and I think it's in MD also, they give you one booklet. All your answers should be answered within that booklet. No additional sheets will be given. So I got time constraints and page constraint. So be very careful in writing things unnecessarily. Read the questions in the first 15 minutes. You dedicate it to read the questions nicely. Mentally make out which one you know answer very easily and which are difficult ones. But the problem is, if you know a question where the answer is very easy, there's a tendency to write lots of pages for that, even though marks is only 3 or 4. So you have to curtail your enthusiasm to write a lot of things. If you know a lot of things, focus your answer, focus inside, tune to the marks that is allotted. And the difficult questions, you can keep it to the last. But most important, read the question. If this question stem has got some breaks, look at the marks that is allotted and answer to the marks that is allotted. Whenever possible, like we gave an example, try and write classification. Use tables and flow charts. Highlight important aspects of the answer. That's what I told you. And take 10 minutes at the end to go through the answer. You can do it in the last, going through each question. And sometimes if suddenly some thought comes, you may add on a few lines. And very important, keep the last half an hour for revision. You have to revise in the examination. But here what revision I've told you is in the preparation, revision of topics which are really important. And if you have still a lot of time and friends, maybe you can do, now you got WhatsApp, you can do a WhatsApp chat and say, I didn't get the answer for this question, can you find out? And if you got a good teacher who can help you out, you can even ask, I don't know the answer for this, how do you answer this? And that's how the teachers will be useful for you. So with that, I think we have spent more than 1 hour. I can stop sharing it. If you got any specific questions, I can answer you. And I hope I have given you an overview of how you approach a theory paper. Any questions? Madam, you can answer on behalf of your students. You can answer on behalf of your students if they have any doubts.
Do we have any questions from the students? Sir, I think as usual, that was an excellent session. Sir is, one word I think Ashta did not mention is sir is a passionate teacher. And you can always see the passion. And today, I think sir has been brutally frank as always and telling you a lot of tips. There are 1 or 2 chats I'll read out, sir. Can we use red pen, color pens, I think, sir?
I think all the examination theory paper, they want you to use the royal blue or black. Red pen can be used to highlight, or you can use a highlighter pen. No objection.
Okay. So from my PG side, there are few always eternal questions like how do they update about recent advances? In DNB, I think there is a paper on that. So do we have any tips for that, sir?
See, problem is, this is a universal problem with all the PGs. They think reading one local small book, George Matthew or something, which will give you points. And in my time, it was Davidson, which used to give you points so that I can write and get maximum mark. None of the postgraduates pay any attention to reading journals. What I tell my first year postgraduate students is, you dedicate 1 day in a week, that is your Sunday, where you half day you are busy with cleaning your clothes and then cleaning your hostel room, whatever. The time where you don't have a serious reading, from day 1, identify some 4 or 5 major journals like New England Journal of Medicine, the BMJ, Indian Pediatrics is easily available. Your teachers, all your teachers will be subscriber for these journals. So go through these articles, and there is some articles which will catch. So look at the editorial, look at some review articles which are given. And sometimes when you attend conferences, recent advances. So you can go through that. But in the last minute, 1 month, going through recent advances may be little tough ask. But what you should read is what is currently in vogue. Maybe you should read about something because there's crops of Kawasaki coming. COVID, you should answer. Dengue, you should be able to answer. Chikungunya. So whatever is currently in vogue, that is what you should be able to read. Otherwise, it is difficult to educate you on how to know about recent advances. And if you are reading from the beginning, at the end of every chapter, maybe you should go through up to date and see if there's, because up to date reviews their articles once in 3 to 4 months, and they have put this article is updated and so date. So most of the recent advances will be incorporated in up to date, and thereby if you're finished reading one chapter thoroughly, go to up to date on those chapters questions, and then you will get reference articles on what is recent.
Okay, sir. Sir, any must-read super specialty books for exam preparation, sir?
Cardiology, definitely, yes. Park, you should read. Because cardiology, there are 2 books. One is Nadas and Park. Park is little more elaborate. Nadas is simple. But in all this, you should remember to read the hemodynamics and the clinical features. Similarly, CNS, I think there are some books for respiratory. Of course, in 1 month, you can't read respiratory. Kendrick's textbook of respiratory medicine is very, very, very good. And in that, you pick up your respiratory. For example, you want to read on cystic fibrosis from Kendrick, or you may want to read on bronchial asthma, or you may want to read on congenital malformations. So let that pick your topic. You don't have to read from wrapper to wrapper.
Sir, I think that was an exhaustive class for exam going PG. Any tips for a PG who's starting off? So is there how to prepare themselves in a first year, second year?
Okay. This is a very important question. I don't know how many first year, second years are there. You have an idea?
Actually, Dr. Ashray, who is actually coordinating, is a second.
Myself, sir.
Anybody else? Okay. I'm going to tell you, provided you follow it, because I'm very conscious about my time. I'm not going to waste my time if you're going to listen to it like a harikatha and then and so this movie was very good and go. You want me to spend 10 minutes time on how to prepare? Then you should implement it.
Yes, so
I want one vocal answer from somebody who is representing all the first years and second years.
Ashray?
Yes, sir. Please, sir. Please do it.
How will I know that whether you implemented what I'm telling?
I'll follow
We
it.
shall.
I'll follow it.
He's your student?
No, sir. I know him just.
Okay.
Sir, one question related is there. Being a secondary DNB candidate, what is the different approach towards the theory exam they want to know?
Secondary or primary approach is forget the bad things that you learned in your DCH. Learn things what I've told you and then prepare. Because what I find is, I don't know, I'm biased. When I see a primary student and a secondary DNB student, it's much easier to teach a primary student because I can take a stick and beat them if they're wrong. But secondary students will come with a preconceived notion. And for me to change their mind is very difficult. They argue with me. No, sir, in my college, they taught like this. No, sir, my teacher told like this. So it'd be very difficult for them to get me into my
I totally
way
agree
of
with
thinking.
you, sir.
So
Totally
somewhere
agree.
the secondary DCH should be humble to unlearn what they have done and don't think that you are great because you're secondary DNB. You are as good or as bad as the primary DNB. Start learning from the scratch. That's what I would tell. Now, as far as the approach is concerned, you got first year, second year, and third year PGs. You have to put what is known as a Gantt chart, G-A-N-T. You make an Excel sheet. One sheet for first year problem, second sheet for second year, third sheet for final year. Divide the 12 months are there. Now, when the first year's PGs are there, that first year gets broken down into 3-month blocks. First 3 months, you do nothing. You just have to get oriented to your institution. Remember which teachers you have to maska, which teachers you have to avoid. Right? All my first year PGs strongly avoid me. They go miles away. They stand in the back. So the first 3 months is to get used to your new environment. Right? Then the next 3 months, what I have seen practically is they go on hunting for thesis topic. You have to focus on thesis topic and you have to spend the next 3 months in behind your guide, choosing the topic, and then synopsis form you should fill up completely. So first 6 months is only this much. Of course, in this time, you will be attending the seminars and classes and bedsides which are done by the seniors. Pay attention, whatever you understand, you start noting it down, right? This is one part. But from the day you join, you will open your standard textbook, whether Nelson, Piyush Gupta or something, read from the first chapter line by line. And by the time you finish 2 years, you would have come to the end of the book. There's no shortcut other than going from page 1 to page 100 or page whatever volume. And I've seen PGs breaking the Nelson into pieces, mutilating. Doesn't matter. They can carry it and read it. So one portion of your reading should be dedicated to reading the chapter 1 to last. So if typically there is a 24-hour day period, 8 hours or 9 hours is gone for your hospital activity, and you will have 4 or 5 hours only, leaving off lunch, dinner, and other things. So technically, you have only 4 hours of reading time at any time. So that 4 hours, 1 hour should be dedicated to reading from first chapter to others. Second hour should be dedicated to what you learned in the seminar, some topics which you did not understand, or some questions which are confusing. Whether you understand or not, you try to read. Third is revise what I read yesterday, third hour. And once a week, you should dedicate it to reading some journal articles, review articles especially. So first 6 months of a first year goes towards this preparation. From second 6 months onwards, you'll start getting seminar topics. So read from books, prepare for seminar well in advance, prepare for bedside. In addition, your continuous background reading will keep on going. So by end of first year, you will have collected your thesis cases, plus you'll have started reading from chapter 1. Second year, first 6 months, you have to focus on your academics, seminars, bedsides, attending conferences, attending Zoom conference, everything. Knowledge everywhere, make notes. That 6 months is all you get to do hardcore reading and learning. Because once you read first half of second year, the second half is completely focused on thesis, results, and going behind your guide. And by end of third year, end of second year and early first year, you should be ready to submit your thesis. By, let us say, the classical calendar year is January, by March, April of the third year, you should be done away with thesis. No questions. And the last 6 months should be revision, chapter by chapter, collecting questions, and every weekend you try and answer some questions and start noting it down. And of course, last 2 months when you get exam leave, go through whatever you have collected and then prepare for the exam. That is my advice. So have a timetable stuck on your table. Say, this is what I want to do. And I have deadlines. 3 months I finish my thesis topic. 3 months I go to guide for this thing. 3 months I write for introduction. Then how I divide my time for reading and continuous reading, revision, all that you should do. Of course, in between, I'm not gender biased, but I know that they get married and they get pregnant. So women PGs, be very clear that how much time you want to give for your marriage and pregnancy related, because that will cut into your academics. A lot of times you may have to come back and work that 6 months extra. So plan that clearly so that you will have a smooth running in the exam. That's all I can tell offhand. Normally, I take 1.5 hours talk class on how to prepare the timetable. Briefly, this is what I can tell.
Okay, so thank you so much. I think at what point do we expect to finish the syllabus in first year was a question. So
there's nothing like finishing the syllabus. I told you, start from first chapter and except the last the 4 or 5 pages where they give the index and the references, you have to read everything.
I think Dr. Arpita is an MD student, so that's why then last 2 months, how much time do we give for practicals, I suppose? So
no, your problem is practicals. You would have got the experience throughout the 3-year course when you're presenting cases and discussing. That's it's because in practicals, what are we trying to look at? We are trying to look whether you have attended wards, whether you have presented cases, whether you're able to analyze cases, whether you're able to build up a differential diagnosis. And we are not worried about whether you're making a diagnosis. So after the theory, you'll have clear 4 weeks or 6 weeks. We can focus on various practical systems. So don't break your head about this thing, because passing theory is the first step for clearing your exams.
I think, Ashra, any more questions? Anything else is there from YouTube?
No, ma'am, that's it from YouTube as well.
Okay. Okay. I thank from my part wholeheartedly for agreeing, sir. As usual, sir is at his best in telling us everything, all aspects of our PG life. Thank you so much, sir. And I think White Army, I have been a fan of White Army. They're doing great. We wholeheartedly thank Dr. Kishan for conceptualizing, and all the people who are working behind the scenes and making it successful. Most of them are seasoned teachers. Here also, the primary aim for a pediatric classes here is to make sure that we cater to your needs. There are n number of channels, n number of ways where you are able to read and learn. Let us make that whatever you require, please message either Ashray or me, so that we can organize pediatric related cases. I think, I'm sure we want Subba Rao sir more often and to guide us for many more classes like this.
Okay, there's a
Ashray?
question on if a